Heartfelt welcome to everyone joining us today. As we observe Mental Health Awareness Month this May, we are here to explore a vital yet often overlooked topic: infant mental health. Infancy is a time when the brain and emotions are developing at lightning speed, laying the foundation for a lifetime of well being. Yet, conversations around this crucial phase remain far too rare. That's why we are honored to bring you today's special webinar titled The Neuroscience of Nurture, a Foundation for Infant Mental Health. And we are delighted to have with us Dr. Raylene, a respected expert in this field, who will guide us through this fascinating science behind early emotional development and the profound role of nurture in shaping your minds. We welcome Dr. Raylene to this program. So, to have a description about our esteemed guest, Dr. Raylene M. Phillips. After raising three children as a stay at home mother, Dr. Phillips received a master's degree in developmental psychology with a focus on mother infant attachment, became NIDCAP certified as a preterm infant developmental specialist, and then attended medical school at University of California, Davis. She completed her pediatric residency and neonatology fellowship at Loma Linda University Children's Hospital in California. She is currently the pediatric department chair and medical director of neonatal services at Loma Linda University Medical Center, Murrieta, and is an associate professor of pediatrics neonatology at Loma Linda University School of Medicine. Dr. Phillips is an international board certified lactation consultant, a fellow of the Academy of Breastfeeding Medicine, and is the medical director of lactation and breastfeeding at Loma Linda University Children's Hospital Level 4 NICU. She is a past president of National Perinatal Association and is currently president of the Association for Prenatal and Perinatal Psychology and Health, a global nonprofit organization with a mission to support healthy infant parent relationships before and after birth. Her passion is to honor and nurture the earliest connections between babies and their parents. We welcome you, ma'am, for this program. Heart-
Hello, and welcome to this session. I'm very happy to share in promoting mental health by participating in this webinar series. My presentation today is entitled The Neuroscience of Nurture, a Foundation for Infant Mental Health. My name is Dr. Raylene Phillips, and I am a neonatologist. As you may or may not know, neonatology is a subspecialty of pediatrics. Neonatologists provide medical care for newborns, which I have the honor and the joy of doing at two hospitals in Southern California in the United States. One is Loma Linda University Medical Center, Murrieta, a small community hospital where we care for both well newborns who stay with their mothers and also for babies who are born sick or premature down to 32 weeks gestation, who need neonatal intensive care in our 6-bed Level 2 NICU. The second hospital, Loma Linda University Children's Hospital, is an academic regional trauma center with an 84-bed Level 4 NICU that cares for babies down to 23 weeks gestation and sometimes even 22 weeks gestation. These babies require an entirely different level of intensive care and come with their own special challenges and opportunities. I am also the current president of the Association for Prenatal and Perinatal Psychology and Health, or APA, which is a global nonprofit organization based in North America whose mission is to provide education for professionals and families about the importance of pregnancy, birth, and the early postpartum period, and on the lifelong impact they can have on the physical and emotional health and well-being of every human being. For over 40 years, APA has been seeking to increase awareness of the conscious nature of babies before and after birth, and sharing how this knowledge changes the way we perceive and care for pregnant mothers and babies in profound and important ways. So I've spent many years caring for and observing both full-term babies just after birth and also premature babies in their third trimester of development. I've also studied the science of bonding and attachment through the lens of both developmental psychology and birth psychology. Before I begin, I want to acknowledge two individuals who have shaped my thinking and inspired my passion for this topic. Dr. Marshall Klaus was a neonatologist and a pioneer in understanding the importance of mother-infant attachment in the critical period immediately after birth. He was also a master in observing newborn behaviors and is one of my personal heroes. And it was Dr. Niels Bergman who first opened my eyes to the neuroscience and neurobiology of breastfeeding and skin-to-skin contact. He continues to be a champion of keeping mothers and babies together after birth whenever possible, so he is another of my personal heroes. A relatively new branch of neuroscience is formally studying the subject of nurture and the science of how it affects brain development and how the quality of nurturing impacts the short and long-term health of the fetus and the infant. To nurture something is to give tender care and protection. If we want to nurture a new plant, we water it and handle it gently, and we protect it from any harm to help it grow to become a beautiful flower, bush, or tree. If we want to nurture a baby, we feed it and handle it gently, and we protect it from any harm to help it grow to become a beautiful child and adult. And new human babies also need something else to help them thrive. They need love. An important mechanism for nurturing babies is through bonding and attachment. The term bonding refers to the emotional connection of a parent toward their baby or child, while the term attachment refers to the emotional connection of a baby or child towards its caregiver, ideally its parents. Both bonding and attachment are necessary for human babies to thrive. Studies have shown that parent-infant bonding and attachment not only have a strong influence on the health and well-being of infants and children, but they can have long-lasting effects even into adulthood. Now, you would think that something with that much impact would receive a great deal of attention during the training of anyone dealing with children, including teachers, pediatricians, and therapists. Yet in medical school, at least, little information is taught about bonding and attachment. It is often considered a soft science, not really important, and sometimes even optional. In clinical practice in the hospital, physical survival is prioritized, which of course it must be, and in clinical practices outside the hospital, physical evaluation and treatment are usually the priorities. And very little attention is usually given to mental or emotional health, especially for infants and children. But good mental health can determine the quality of our lives. We now understand that we cannot separate the well-being of the mind and body because they are intricately connected. And we have learned that emotional and psychological health have a great impact on physical health. Ancient cultural medicine practices have known and taught this for centuries. Dr. James McKenna is an anthropologist who has studied the development of many species of mammals. In his studies, he has seen that human babies are born quite neurologically immature compared to other newborn mammals. He says that at birth, the human infant is the least neurologically mature of all primates. The immature human brain makes human newborns more vulnerable. Humans and monkeys are both primates, but newborn monkeys have the ability to actively cling to their mothers as mother moves about and swings through the trees, while human newborns are much more helpless at birth. Dr. Nils Bergman, a developmental pediatrician, explains that the brains of newborn primates at birth are more developed than human brains are at birth. The brain of a newborn monkey is about 80% its full adult brain size, while the brain of a newborn human is only 25% full adult size. This is because human females cannot get a baby with a brain that is 80% full adult size through the human birth canal. Human babies' brains don't reach 80% adult size until around 1 year of age, and during their first year of life, their brains continue to grow and develop. The human baby actually needs 12 more months of neurological gestation outside the womb to be at the same stage of motor development as the monkey baby at birth. A 1-year-old human baby has the ability to sit on his mother's hip and hang on to her as she walks around the house, something the baby monkey could do at birth. On these brain images, you can easily see how at birth the newborn human brain is about 25% the adult brain size, and at 1 year it is around 80% full adult size. Now we can better understand why Dr. McKenna said that at birth the human infant is the least neurologically mature of all primates. He went on to say that the human infant is the most reliant for physiological regulation by the caregiver for the longest period of time. Much animal research has confirmed that all baby mammals are more physiologically stable when they are with their mothers. This is because nature has prepared the mother to be the newborn baby's physiological regulator. A newborn baby has a biological need to be in contact with its mother. After birth, skin-to-skin contact and breastfeeding are the ways the neurologically immature infant continues neurological gestation outside the womb. As we have seen, skin-to-skin contact with mother is where all their needs are met for warmth, nutrition, and safety, and continued brain development as well. Skin-to-skin or very close to mother is the best place for human babies to continue their neurological development after birth. What about premature babies? Premature infants are still in fetal stages of development, and all their organ systems are immature when they are born earlier than expected. For example, the preterm infant's lung development is not yet complete. Bronchi, bronchioles, and alveoli can still be forming and developing in babies born very premature. The picture on the right illustrates a well-developed and functional mature lung. But the younger the preterm baby is at birth, the less developed are its lungs, and in the NICU we frequently care for babies born at this stage of lung development. Similarly, the preterm infant's brain development is also not complete. Depending on how early a baby is born, new neurons are still being made and migrating from the germinal matrix to their final destination in the brain, so that the brain will be able to function properly. Formation of new synaptic connections occurs in the 3rd trimester and continues forming after birth for both the full term and the preterm baby. Here is an illustration representing the synaptic connections a fetus or preterm infant would have at 36 weeks gestation, and how these increase at full term, or about 40 weeks gestation, at 3 months, at 6 months, and at 2 years of age. Synaptic connections continue to form throughout life, but a very preterm baby is just beginning this process. We know how much the fetal brain changes over the course of a normal pregnancy in size, in weight. Just look at the change in brain weight of a baby born at 34 weeks and a baby at 40 weeks. And also in morphology. If a baby is born very prematurely, all of the brain development you see in the box, or the red box, may occur in the NICU. If a full-term human infant needs to continue about 12 months of neurological gestation outside the womb before their brain will reach the same percentage of adult size as the newborn monkey's brain, then depending on how early a baby is born, a preterm infant will need to have up to 4 extra months of neurological gestation outside the womb. And much of this extra time may be spent in the stressful environment of the NICU instead of the developmentally expected environment of the womb. Even though they are born prematurely, skin-to-skin contact and breastfeeding are still the ways preterm infants continue gestation outside the womb. While breastfeeding will need to wait until the baby is ready for oral feeding, skin-to-skin contact is even more essential for preterm infants who are even more dependent on the physiological regulation that mother provides and who need much longer to continue neurological gestation outside the womb. Skin-to-skin contact with mother is as close as a preterm baby can get to being back in the womb. Of course, we know that some babies really are too sick at birth, and these babies do need aggressive resuscitation and ongoing medical care. But we have learned from research and from our experience that most preterm babies are more physiologically stable if they are in skin-to-skin contact with mother or father or another emotionally invested family member than if they are alone and separated from their mother, who is their intended source of physiological regulation. Those of us who care for premature infants in the NICU have a unique window into the womb. Preterm infants in the NICU display many of the same behaviors they engaged in while they were still in the womb. They bring their hands to their faces and often suck on their fingers just as they did inside the womb. They push their feet against the boundaries in the NICU just as they once pushed against the walls of the uterus. In the NICU, they grasp any tubing within reach, just as they once grasped their umbilical cord in the womb. Neuroscience has found that early brain development is an active process that depends on individual experiences, beginning in the womb and continuing after birth. What the baby experiences influences the formation of synaptic connections and other factors in brain development. The brain of a baby who spends the 3rd trimester in the NICU will develop very differently from the brain of a baby who spends the 3rd trimester inside the protective environment of the womb. No matter how small or how premature babies are in our NICU, they are still aware of and react to their surroundings. Even very preterm infants are capable of having their own experiences and their own feelings, and they respond in individual ways to their environment and how they are treated. Creating emotional connections is how we nurture our babies and children. Maternal bonding comes first and can begin well before birth. Even premature infants are born ready for connections, with various ways to express it depending on their gestational age at birth. If we look closely, we can often see the same curiosity and alertness that we can see in full-term infants just after birth. We see how focused they are in looking into their parents' eyes, even while practicing breastfeeding. So since we know preterm babies are born ready to connect, how can we support nurturing experiences for babies in the NICU? As we have seen, nature has prepared mothers and fathers to nurture their babies. So our task in the NICU is to support parents in providing nurture to their own NICU babies immediately or as soon as possible after birth. This mother is nurturing her prematurely born baby while holding him skin to skin in kangaroo care. The words on the wrap that holds the baby safely next to her skin say, "Rest and grow close to my heart and know you are loved right from the start." As we have seen, a preterm fetus is more stable with mother. Studies have shown that even extremely preterm infants are more stable with their mothers, even if they need respiratory support. This is Reed, born at 25 weeks gestational age, weighing 650 grams. When this picture was taken, he was 5 days old and on high-frequency jet ventilation. But he required less oxygen when he was skin to skin with his mother, even when separated from her inside his incubator. Less exposure to high levels of oxygen will make a big difference in his lung development. A recent study done in 5 developing countries monitored preterm infants with birth weights 1 to 1.8 kilograms and found that those who had immediate kangaroo mother care and near continuous skin-to-skin care after birth had a 25% decreased mortality rate at 28 days of life. 25% fewer deaths. Multiple studies have shown that skin-to-skin contact in the NICU promotes bonding and attachment. If bonding and attachment are occurring with mothers and preterm babies in the NICU outside the womb, then we know that it can already occur with mothers and babies who are inside the womb as well. Dads need to bond too, of course, and babies are just as capable of bonding with dad, either inside the NICU or inside the womb, by hearing their voices and feeling their touch. In the NICU, we actively support bonding and attachment between parents and their preterm babies. We encourage parental presence in the NICU, and we facilitate early and frequent and prolonged skin-to-skin contact. And we encourage softly talking or singing to preterm babies. What are the effects of talking to preterm infants in the NICU? Does it make any difference? The effects of maternal voice on preterm infants in the NICU has been the focus of increasing research. A systematic review of maternal voice interventions found increased stability in preterm infants when they heard their own mother's voice in the NICU. In this study, exposure to mother's voice and heartbeat influenced auditory plasticity in the brains of preterm infants who heard recordings of their own mother's sounds for 3 hours a day for the first 30 days of life in the NICU. Here you can see the resulting increased thickness of the anterior commissure, which is an important white matter tract that connects the left and right hemispheres of the brain. Functional MRI was used in this study to assess brain responses of 10-year-old children who were exposed to the voice of their own mother compared to 2 female controls, and found their own mother's voice elicited greater activity in primary auditory regions in the midbrain and the cortex. This study showed that the strength of the brain connectivity during mother's voice perception predicted the social communication skills in these 10-year-old children. And as we will see, this process begins before birth. A very intriguing study entitled Adult Talk in the NICU with Preterm Infants and Developmental Outcomes was done by Dr. Betty Vore at Brown University in Rhode Island in the United States. Dr. Vore had discovered in one of her earlier studies that extremely premature infants vocalize or make little sounds 8 weeks before their mother's due date. And the babies vocalized more when their mothers were present in the NICU than when they were cared for by NICU staff. Dr. Vore's studies had found that vocalizations of preterm infants were very distinct from their cries, and that preterm infants make far more vocalizations than they do cries at every gestational age. They also discovered little conversational turns between the mother and the infant, which involved the words of mother or the vocalizations of infants within 5 seconds of each other. The study that she did involved 36 preterm infants in a NICU at Brown University. When these babies were 32 weeks and again when they were 36 weeks gestational age, researchers recorded the NICU environment for 16 hours with a language environment and analysis microprocessor. The computer recorded all sounds in the environment and analyzed the number of adult word count, baby vocalizations, and conversational turns between the mother and the infant. It was noted that some parents talked directly to their babies during the study, while other parents simply held and rocked their babies or caressed them but didn't talk or sing much. Some parents were not even present during the study. So in both of these last two cases, the babies didn't hear many words spoken directly to them. It was also noted that nurses rarely spoke directly to the babies during their caregiving activities. Bailey 3 developmental evaluations were done at 18 months, and results showed that for every increase in 100 words that adults spoke directly to babies during the study time at 32 weeks corrected gestational age, these babies had a 2-point increase in language scores at 18 months of age and a 0.5 increase in expressive communication score. A 2-point increase for every 100 words spoken during that 16-hour period. Premature babies in this study benefited most when their mothers spoke directly to them in attempts to engage them in conversation. This was compared to if their mothers simply stroked them without speaking directly to them, or if the babies were primarily around nurses who talked about them or around them but didn't address the babies directly. Dr. Vore commented, "To me, it's amazing that 8 weeks before their expected delivery, the role of the parent is so powerful in predicting language outcomes. This just really involves talking to NICU moms and informing them, you have an important role here, and you can make a big difference for your baby simply by being here and talking directly to your baby." Now we know if this is true for preterm babies in the NICU, it is also true for babies of the same gestational age who are still inside the womb. Dr. Martha Welch, a child psychiatrist, and Dr. Michael Myers, a psychologist, work at Columbia University Medical Center in the United States. Together, they developed a program called the Neuroscience program in their NICU to put the neuroscience of nurture into practice. They recognize that mother-infant separations in the NICU cause emotional trauma. So they help parents and preterm babies to have an emotional connection each and every day. The goal is to reconnect and relax from the NICU stress by using simple interventions. Trained nurture specialists support mothers and babies in 1-hour calming sessions every day for 6 days a week. They use 3 simple tools: kangaroo mother care or skin-to-skin contact, talking to the baby, and a scent cloth. The scent cloth carries mother's scent or smell, and it stays with the baby even after the session is over. The mother and the baby are always thought of together as a pair, and interventional activities are deliberately designed to create emotional connections between them. The Neuroscience program results of their first randomized controlled trial at 4 months corrected gestational age showed a significant decreased maternal anxiety and depression rate. At term corrected age, babies who received the maternal nurture intervention had dramatically increased brain activity in the prefrontal cortex. At 18 months, results showed significantly increased cognition and language development, and there was a significant decrease in autism. At 4 to 5 months, results found improved autonomic regulation in both mothers and children who had received the family nurture intervention in the NICU. In the last few decades, neuroscience has been studying the purpose of bonding and attachment relationships. In the past, we thought bonding and attachment relationships were mostly to create a sense of safety and security for infants and children. Now we know that bonding and attachment relationships have a major effect on brain organization and development, and can even affect brain structure and function. Since it's clear that preterm babies in the NICU are very capable of perceiving and responding to their mother's presence and voice, what evidence do we have that babies still inside the womb can also perceive and respond to their mothers before birth? It has been found that when pregnant mothers touch their abdomen, the fetus displays increased arm, head, and mouth movements. When pregnant mothers talk, the fetus has decreased arm and head movements, as if they are holding still to listen. By using non-invasive functional MRI, it has been found that unborn babies around 33 to 34 weeks gestational age can distinguish their own mother's voice from an unfamiliar female voice and also from pure sound. And these distinctions can be seen as differences in brain activity in auditory centers in the temporal lobes. The upper bank of the temporal lobe showed specific sensitivity to any speech, while the lower bank of the temporal lobe was more active during exposure to maternal voice than to an unfamiliar female voice. Unborn babies can recognize familiar word sequences. When mothers recite a child's rhyme daily in the last few weeks of pregnancy, their unborn baby begins to have changes in fetal heart rate when they hear their mother recite the now familiar rhyme. In this study, fetal heart rate variability was monitored while the pregnant mother either communicated directly with her unborn baby or talked about the baby to another adult nearby. We know that higher heart rate variability is an indicator of lower stress and increased well-being. And as you can see, the heart rate variability increased significantly whenever the mother communicated either with the fetus or when talking to another adult about the fetus. But the heart rate variability increased significantly more when the mother communicated directly with the fetus, either vocally or silently, than when mother communicated about the fetus to another adult, demonstrating that the unborn baby can tell the difference. Mother-preterm baby connections are seen every day in the NICU. Look how attuned this little one is to his mother's voice. Developmentally, he should still be inside the womb. And if he were, he would be just as capable of tuning to his mother as we see is possible in the NICU. When mother consciously connects with their unborn babies, we call this prenatal bonding. Of course, prenatal bonding is nothing new. Mothers have been talking and singing to their babies and stroking their babies inside the womb for millennia. But now we have increased awareness of the unborn baby's capacity to notice and to respond, and we also have evidence to show the benefits of babies and mothers of creating emotional connection as soon as possible, beginning in the womb. There are many forms of prenatal bonding that involve talking or singing or playing music or touching and caressing the abdomen or visualizing the unborn baby. There are also many different programs around the world that use these techniques to educate and support mothers in bonding with their babies before birth. I've listed several examples here in Russia, in Texas, which is in the United States, in Denmark, and in Germany. A cohort study published in 2003 evaluated birth outcomes of 295 mothers who participated in the prenatal bonding BA program, which was created by a Hungarian psychoanalyst, Dr. Jenő Rafai, in the 1990s. The study participants were mothers in Germany, Switzerland, Austria, and France who received prenatal bonding facilitations between 2017 and 2020. Compared to birth outcomes of the general population in their country, pregnant mothers who had consciously and actively connected with their babies before birth in the prenatal bonding BA program had significantly decreased rates of preterm births, less than 1%. They had fewer C-section rates. A total of 242 women, or 82%, gave birth vaginally, while cesarean section births that were clinically indicated were only for 53 births, or 18%. They had higher rates of breastfeeding rates at birth and also at 6 months. They had almost no colicky babies and very low rate of baby blues in mothers after birth, and almost no postpartum depression, less than 1%, whereas the rate of postpartum depression around the world is between 13 to 19% in the general population. Recognizing babies in the womb as conscious sentient beings with the capacity to have their own feelings and experiences makes it possible for us to understand that mothers can form a very real connection with their babies before birth. This knowledge compels us to change our language around pregnancy. When someone is pregnant, she is not expecting a child, she already has one. She is not going to be a mother, she already is a mother. The baby is not on the way, the baby has already arrived. If we are going to change the way society treats pregnant mothers and unborn children, we need to change the way we talk about them. Prenatal communication, or talking to babies in the womb, is a form of prenatal nurturing and bonding that doesn't have to wait until after birth. According to the developmental origins of health and disease, the womb may be even more important than the home in influencing lifelong physical and emotional health and well-being. At the very least, prenatal bonding and nurturing is a way to optimize the womb experience for unborn babies, as well as the pregnancy experience for mothers. What we have learned is that nurturing babies with loving communication in the womb, in the NICU, and in the home supports optimal brain development and emotional connections. Every human being needs love from the very beginning of life to help them develop into their highest potential. By communicating with babies in the womb, parents can begin to nurture their babies well before birth. By supporting a gentle birth and keeping newborns and their babies and their mothers together after birth in uninterrupted skin-to-skin contact, we can support continued nurturing to meet the needs of our newest little human beings. Dr. Thomas Verney, the founder of APA, has said, "Womb ecology is world ecology." We know that a healthy womb contributes to creating a healthy world, and that a peaceful birth contributes to creating a peaceful society. Suzanne Arms, who is a gentle birth advocate, says, "If we hope to create a nonviolent world where respect and kindness replace fear and hatred, we must begin with how we treat each other at the beginning of life, for that is where our deepest patterns are set. From these roots grow fear and alienation, or love and trust." I want to acknowledge all that you are doing to support mothers, babies, and families. And I hope that neuroscience has provided enough evidence today to motivate and inspire you to continue and expand the important aspect of your professional work. By supporting human connections that nurture babies as early as possible before and after birth, we are supporting the development of more compassionate children who are more likely to grow up to become more compassionate adults who can help to create a more compassionate and peaceful world. Thank you for your attention.